Let's talk about the heart sounds. They are caused because of the movement of blood. They are lub and dub. The first one is going to correspond to the AV valves closing. That marks the start of ventricular contraction, in other words, ventricular systole. The second sound is going to be associated with the aortic and pulmonary semilunar valves closing and will occur during ventricular systole, in other words, ventricular relaxation. If you have a heart murmur, they are going to be due to the turbulent backflow of blood through a valve because it is not closed tightly. Let's talk about cardiac output. It is the volume of blood pumped by each ventricle in a minute. It is determined by heart rate and stroke volume. It is very precisely adjusted automatically to meet the needs of your tissues. So the equation is, you need to know both the definition and the equation. The equation is CO for cardiac output equals HR for heart rate times SV for stroke volume. Stroke volume is the volume of blood that is pumped out by a ventricle with each beat. Remember that both ventricles will pump the same volume of blood. Normal CO is about 5 liters. That shows you what you need to calculate cardiac output. That's the equation. More information for those people who are more visual. Your resting heart rate will vary depending on how old you are, what your general health is, and what your physical conditioning is. Normal range heart rate is about 60 to 100 beats a minute. If you have a slower heart rate than normal, that is bradycardia, generally less than 60 beats a minute. And if you have tachycardia, you have a normal, faster than normal heart rate, generally greater than 100 beats per minute. How do we regulate the cardiac cycle? Our friend, the autonomic nervous system. Remember that there are going to be cardiovascular centers located in the medulla. There'll be a cardioacceleratory center, which is going to control sympathetic neurons. And when you hear sympathetic, think fight or flight. So sure enough, you're going to be increasing your heart rate. There will be a cardioinhibitory center associated with the parasympathetic nervous system, which will slow heart rate. And the parasympathetic supply to our heart is through our favorite cranial nerve, the vagus nerve, cranial nerve 10. If you are under stress, you will have increased heart rate. Okay, so we talked about the endocrine system, and we talked about the hormone epinephrine, which is released by the adrenal medulla. That will increase heart rate. Your heart rate will also decrease with age. It will also depend on your gender, temperature, your emotional state, and whether or not you have any pathology.